Hi class, and welcome to chapter 3, where we're going to be talking about psychological health and well-being. Remember that everything starts in the mind, so that's really what this chapter is going to focus on. If you want to have a piece of paper to take some notes on the side, that'd be great. If you need to pause this at any point to be able to go ahead and take those notes, feel free. I do have books, as always. I have different resources, so hopefully I can give you some different aspects and some tools to be able to utilize today, starting today, to help with that psychological health. All right, let's get started. So first off, let's go ahead and identify what psychological health is. It's going to be a very broad concept, identified as negative or pessimistic mindset. It could be identified as an optimist or a positive mindset. It's going to contribute the absence of sickness, but the general idea and the general point that I want to make with this slide is that psychological health contributes to every dimension of wellness. So physical wellness, emotional wellness, all of it is going to start in the mind. Similar to what we talked about in class the past couple weeks, everything starts in the mind. It all starts with a mindset. And we know that there's an increase in anxiety disorders, there's an increase in PTSD, ADHD. So if we can talk about psychological health and we can identify particular factors, then what we can do is we can provide tools that you can utilize starting today to be able to help you manage those psychological and emotional factors. We want to start with Maslow. His research showed us that there's a hierarchy of needs. And for those that are very visual, I do have a graph in a couple slides, so bear with me. But the main 5 points of the hierarchy of needs, first off, is going to start with that physiological need. That's going to be the most important. So that's where we're going to talk about breathing, food, water, shelter, excretion of toxins, right? Being able to expel the different types of elements from our bodies to be able to keep us from going into toxic shock and to be able to keep us at that homeostatic basis. And everything we've talked about so far, we know that in terms of health, the body is consistently trying to get back to homeostasis. So however it needs to get back to homeostasis, that's what it's going to do and utilize. Back in the day with our ancestors, they didn't have the amounts of stressors that we have in today's day and age, i.e. being the phone, social media, bosses, deadlines, timelines, etc. So what we need today for us to be able to maintain that homeostatic balance is to be able to have tools, and one is to control that positive psychology or create that positive psychology. Next one's going to be safety and security. So in today's day and age, employment, family, health, obtaining property, there's going to be different areas that you want to look at. Love and belongingness, this is where we kind of go internal and we look at more of the social networks that we have to help to support us. Next one's going to be self-esteem, and then last one is self-actualization. And again, I have a graph later that will kind of put it into a visual perspective for you. All right, when we talk about self-actualization specifically, it's going to be a state met by people who have fulfilled a good measure of the human potential. So this is where we really talk about purpose. And everyone has a purpose, whether you realize it or not. And we know that you can take religion out of it, you can take God out of it if you want. But we see that in science, that those that have a purpose are the ones that end up having a longer longevity, or they end up living longer. If we look at the blue zones, we talked about blue zones last week, those are going to be areas where individuals live to be centurions. It's the highest amount of centurions. And in those areas, we notice that a huge aspect that connect all of them is not just health, it's not just lifestyle, but it's purpose. It's the idea that they have a reason for being here and continuing to live on this earth. And that purpose is going to be different for everyone. But that self-actualization after the other steps is something that we really want to obtain, and something that we really want to identify and focus on. All right. We know that we have autonomy. It's going to be physical, social, emotional, and intellectual independence. Right? So a lot of times individuals, especially when it comes to self-esteem, will rely on other individuals to kind of tell them who they are and make themselves feel good about this. The goal of this course is to give you the tools that you can do this independently for yourself. All right? We'll talk about the capacity for intimacy. We'll talk about creativity. Everyone was created to be creative. All right? Everyone's created to be creative. So we want to find what is that source that we can bless other individuals with our creativity. All right, so here's the chart that I wanted to show you guys, and I like this because the pyramid kind of gives us an idea of what is going to be our basis, what is going to be our foundation, and what we can work up to. All right, So again, first one we talked about psychological health. That's going to be our basic needs. There's a difference between what we need and what we want. And a lot of individuals can't really identify the two. We need food, but you don't need to go to In-N-Out every single day, right? We need shelter, but you don't need a 20,000 square foot home to provide that shelter, all right? You need sleep, but you don't need 15 hours of sleep a day, right? So again, it's coming back to that homeostatic balance. And in this category, more doesn't necessarily mean better, all right? So there is an idea that if you're stuck out in the cold, you come inside, someone gives you warm clothes, they give you a warm beverage, and they give you a fire. That's going to mean all the difference in the world to you, all right? But we have to understand, where are we coming from with that? Now, we can take a look at, let's say, Black Friday, for example. There are a lot of health issues that we've seen connected to the idea of Black Friday and the idea of obtaining objects. Just because you have more doesn't necessarily mean that you're going to be happier. It's all dependent on the situation, so we want to keep that in mind. Again, safety, we talked about that. Health, that's what this whole course is about. We talked about employment, which when we get to the financial chapter, that's going to be huge for you guys. Loving and belonging, this is all about our social connection. And just because you have friends on social media does not mean that you're fulfilling this category. So it's very important to understand that there is a difference between a physical interaction, being in the presence of an individual, and a media interaction, or looking through a camera or through a phone at an individual. The chemical release in the body is going to be very different with those two different scenarios. All right. We talked about self-esteem. We know that in high school, this is going to be a huge area that's being developed, and that's okay, because understandably, your parents growing up told you who you needed to be, and now you're in the stage of becoming who you want to be. So that self-esteem, it can be kind of a wavering board. So we want to ensure that we do have a positive and we have a healthy mindset to be able to take in whatever criticisms that we experience, because everyone that's gone through high school has experienced some sort of criticism in terms of what they're doing. And as you get into the adult realm, it doesn't change. Someone will always try to put their opinion into your life. So having that internal self-esteem without the need for other validation from individuals is going to be huge for that mental and psychological well-being. And then again, self-actualization. So finding your purpose. And hopefully by the end of this course, I can provide you with those tools where you can have a clear vision on what is your purpose, and you can take that and do with it what you will and bless other individuals in life. All right. Positive psychology. So we know that a lot of individuals will categorize themselves as optimists, right? This is going to be an idea or a mindset that's focused on defining goals and ways to achieving them. So one of my favorite lines that I utilize now is from Rich Dad, Poor Dad. And he says that instead of asking or telling himself that he can't afford something, he would ask himself, how can he afford something? So that unleashes that idea of creativity. It doesn't put a mental blockade. And that's what a lot of optimists do. Those that naturally have that positive mindset, they figure out and they creatively find different ways to achieve whatever goal it is. All right. Martin Seligman is an individual that really kind of devoted some time to this and validating or finding different dimensions. So in a positive psychology or mindset, he found that pleasant life is going to equal maximize positive emotion, right? And a pleasant life is going to mean something different to everyone. So don't think that just because this person's saying they have a pleasant life, you have to have X, Y, or Z, that's what you have to have. Again, it's on an individual basis and it's what you actually want. But that goes into knowing yourself and understanding what you want that will actually make you happy, not what everyone else is telling you is going to make you happy, all right? So engaging in life, cultivating positive personality traits. Emotional intelligence is big in this, and we know there's a lot of studies that have been going on with emotional intelligence and finding that those qualified and most effective leaders have that emotional intelligence. And I have a resource for you on the next slide. So we'll talk a little bit more about that. But that's really just understanding your own emotions and understanding the emotions of others and really having that vulnerability and that empathy for individuals. That is really going to excel you in life regardless of what you're trying to do, if you're trying to be a leader or if you just want to help clean up toilets or whatnot. Having an emotional intelligence is really going to excel you in that realm. All right. And again, going back to purpose, last one is meaningful life, working with others towards a meaningful object. So you'll notice that there's kind of a a sequence in all of these slides throughout this lecture that it's really about what can you do for other individuals and how can you bless other individuals. So getting out of yourself, getting out of that selfish mindset, and understanding that there's ways that you can bless others, and in return that you will be able to have those blessings and that wellness. All right, so emotional intelligence, the textbook or the actual book that you can purchase that can help you develop your emotional intelligence is by Travis Bradbury and Jean Greaves. And it's a really good read, a really easy read. It's kind of a textbook and a workbook at the same time. So what you can do is it'll give you a quiz. It'll identify areas of emotional intelligence that you should work on. And these are the 4 areas. So self-awareness, self-management, social awareness, and then relationship management. So you notice that all of these are dealing with your interaction with other individuals. And this always brings back to mind social media, because we think that we're interacting with other individuals, but we're not near this level of interaction as we would if we were actually in person with the individual. All right, so that's why you can see how a lot of social media relationships end up bad or end up unhealthy, is because we're not actually utilizing naturally all the different areas that were meant to be utilized when we interact with other individuals, right? So first one, for self-awareness, know your emotions. It'll help you, that textbook will help you understand how well you know your emotions. And if you don't know your emotions very well, then it'll give you exercises that you can utilize that can help you start to understand and identify your emotions. Because oftentimes we have individuals, they had a bad day or they're sad about something, someone said something mean to them, and all of a sudden they identify as depressed. When we know that depression is a more severe state, right? It can lead to chemical imbalance, which we'll talk about later. So just because you're sad doesn't mean you're depressed. So learning how to identify those emotions is going to be huge for that. Self-management, you identified the emotion, now how are we going to manage it? And that's what we're going to talk about at the end of this lecture. Next, social awareness, so recognizing and understanding other people's emotions. Some individuals naturally get this, some individuals don't. What I find personally is that if you've been in the situation where you've dealt with an abusive family member or someone that has been physically, emotionally, verbally abusive, those individuals tend to develop the skill to be able to read individuals' emotions a little better than those that haven't had to deal with that. So if you've had a tough background like that, take that as a strength. Because even though what that person did, there's no excuse for it, but it's helped you to develop this social awareness to be able to analyze and view other individuals' emotions. All right, and then last one, relationship management. When you build those relationships or the relationships you currently have, how are you going to manage those relationships? All right, that's going to be important. What is psychological health and what it's not, right? So we talked about psychological health as being a gateway to wellness, to overall body wellness. What psychological health is not is the idea of being normal. So in our society, we like to categorize individuals because it makes us feel a little more comfortable on how we're going to interact with them. So either you're a teacher or you're a doctor, or you're an adult, you're a child. So it really helps us psychologically to be more comfortable with that relationship. But what we want to get away from is saying that if you're psychologically healthy, that means you're normal, because we really don't have a baseline for what is normal. Everyone's so different, and the experiences develop different things in individuals. So we want to get away from that stereotype of normal. Right? Another stereotype we want to get away from is that if you seek psychological help, that means you're crazy, right? Culturally, we've kind of moved away from this, which is good. In this type of area, when it comes to psychological health, you really want to go to an individual that is well versed on this, that has studied this, right, and that has good results from this. And you want to make sure that it's an individual that has a healthy psychological balance themselves, right? Similar to if you want to get rich, you're not going to go to the poorest person on your block to get advice, right? You're going to go to someone that's actually living it and breathing it. So keep that in mind. Another one is people cannot be mentally ill or mentally healthy solely based off symptoms. So when it comes to symptoms, we're understanding in science that the gut bacteria has a lot to do with the brain chemistry and what's going on in the brain. So just because someone has certain symptoms, just because, let's say, you've been sad all day today, doesn't mean you're clinically depressed, right? It just means you're going through something, and hopefully these tools that I give you later will help you kind of pull yourself out of that. And lastly, psychological health can't be judged by outward appearance. You never know who's dealing with what psychologically. Some individuals, if they're dealing with trauma or they're dealing with something very traumatic emotionally, They'll throw themselves into work, or they may throw themselves out on the streets, right? So one thing that we want to get away from is judging individuals based off what we see, or judging a book by its cover, right? We want to try to develop that emotional empathy to really understand the individual. All right. Growing up psychologically means developing coping mechanisms in meeting life's challenges. So Erik Erikson is an individual that's done a lot of research in this, and he's identified development of life through several different stages. All right, so we understand that, especially at the stage that you guys are at, is we're trying to develop ourselves to become that adult person, but keep in mind that you're never done developing, right? Just because you turned 18 or just because you turned 21 doesn't mean you're adult. It just means that legally you're able to do certain things based off your age, but it doesn't mean that in terms of your identity, you're done. And your identity is consistently shifting. So keep that in mind, all right? So when we talk about values, what you want to find is your personal values, and what are the things that no matter what your external situation is, what are the things that you will consistently go to as your ethical, compass, all right? So those that don't know what value is going to be the criteria for judging what is good and what is bad, all right? And it's going to be something that guides your moral decisions and behaviors. So those that are believers in Christ, the Bible generally is going to be a method of values for them. We get our values from our parents, all right? We get our values from the individuals we're around. So take a look at the individuals that immediately surround you, the ones that you're around the most. And those are going to be where you're getting a lot of your values from. If you find that you have a relationship that really isn't working out, take a look at those values. Because when we break everything down to the core, when we have good relationships, that means that those two individuals, their values are going to align. If those values don't align, then there's going to be hostility, there's going to be issues, there's going to be fights, there's going to be not so much trauma, but there's going to be turbulence in that relationship. So take a look at those values and take a look at your core values. And one really good exercise is to actually write down your values, because once we actually visually see these and we put in action towards it, it's easier for us to identify our relationship with other individuals, especially if you're looking for a mate or a partner in life. You want those values to line up. So identifying your personal values is going to make it a lot easier for you to kind of weed through those other individuals whose values really don't align, and really spend time and energy on the individuals whose values do align. All right. So different stages of development for you visual individuals. This is going to be a good graph for you. So from birth to 1 year, generally we're going to try to develop that trust and mistrust. That's where we're going to learn who can we trust and who can we not trust. Again, generally at this stage, it's going to be the parents that we learn to trust, right? But as you see, as we get older, that can tend to change, all right? So 1 year to 3 years, this is where we start to develop autonomy versus shame and self-doubt. Those that want to be parents in the future, keep in mind that it's easier than you think to pass on your vulnerabilities and your insecurities to your children, right? One very common one is mothers or aunts with young girls. Young children, as they're growing up, they really don't have an idea or focus on their personal physical state. So if you have a child that's a little overweight, generally they're not going to have awareness of that until someone brings awareness to them, right? So if you're consistently concerned about your weight and you're a mother and you're constantly weighing yourself every day, that's going to be something that your child sees, and now you're bringing awareness to them, and so that can start to develop the insecurities, that can start to develop the self-doubt, right? When at this stage, especially birth to 5 years, we want to start bringing our children up. We want to instill those positive psychological well-being tools in them. We don't want to give them tools that can help them tear themselves down easier, right? So if you take a look, 6 to 12 years, that's where we start to get into the industry. That's where we start to get into the social aspects of things. So the neighborhood kids, the school kids, who are you actually hanging around with? There's a really famous quote that says, look at the 5 people you're around, and that's who you're going to become. All right, so take a look at the top 5 text messages that you have. Take a look at the top 5 people that you've called. Take a look at the top 5 people you spend most of your time with. That's going to be your future. And if you don't like your future, then there's things that you can do to go ahead and change that. But you have to be aware of that in the beginning. All right. We have the next stages, which is adolescence. That's where you're at. A lot of the influence is going to come from your peers. So again, look at your friends. Who are you around? If you're around individuals that are snorting lines of coke and stealing from Walmart, and you know that's not the future you want to have, you probably want to go and change that. We move into young adulthood. That's where our group of friends starts to narrow, right? So instead of quantity, we're starting to look at quality of friends. We have middle adulthood. It's going to be our work. It's going to be our children. When you start to have a family, it's going to be the community. And then as we get older, what Erickson has noticed, that we start to have a viewpoint more so on integrity versus despair, and looking at humankind and looking at ways that we can actually help those individuals. All right, so achieving healthy self-esteem. So we talked about self-esteem earlier. You really have to focus on developing that positive self-concept. All right, so one thing that I talked about in class with you was either putting post-its on your mirror or the term I'm looking for. Really speaking positively to yourself, right? So you look in the mirror and you tell yourself, I'm beautiful, I'm successful, I am intelligent, and I provide value no matter what I do, right? Even if you don't believe it at first, just the action of saying those words, your brain is going to catch on, right? Because whatever we do, whatever words we put out there, words are very powerful. So you want to ensure that the words that are coming out of our mouths, that those are going to be positive, especially when it comes to our self-esteem, right? The biggest area that I find individuals look at, especially with the advent of Instagram and individuals posting photos, is that the amount of likes they get or the amount of comments they get, they start to correlate their personal value with that, right? When at the end of the day, it's just someone's opinion, right? But how you personally feel about yourself, that's what's going to get you to that success stage, right? If you consistently feel like that you're worth nothing, you're not going to do anything, it's a self-fulfilling prophecy, right? If you believe you're truly going to become a stripper and live behind Stater Brothers, then you will take the actions it takes to become a stripper and live behind Stater Brothers, right? But if you put out those positive, some people will call them vibes for yourself, then your actions are going to follow. That's how smart the body is, and that's how smart the brain is, and that's how much the psychological well-being matters in terms of your personal life success. All right. So especially in high school, there's a lot of challenges to self-esteem, right? One of the big ones is media and individuals or companies telling you should look like this, or you should have a six-pack, or you should be waist 24 inch, or you should wear these jeans. There's a lot of input that's coming from the external environment that's telling us who we should be. It's very important to take time, quiet time, away from other individuals, away from other factors, to really see what do you want. If we are continually bombarded by external factors, we're never going to be able to have that quiet time for our brain to be able to tell us and develop us into the individual that we truly individually should be, and that includes self-esteem, right? So developing realistic self-talk, right? Making statements to yourself. These are very, very important things to do. And when I say realistic, I don't mean pessimistic. A lot of individuals would get those two confused, right? And we understand that earlier we talked about pessimism is more of a negative mindset, where realistic self-talk is being honest and true to who you are, right? So when it comes to psychological defense mechanisms, there's some healthy defense mechanisms and there's some unhealthy defense mechanisms. So this is going to be the stage where I give you some tools to be able to help you. If you do find yourself in more of the pessimistic stage, you're calling yourself a realist, but you're being super hard and super tough on yourself, hopefully these tools can help you out, all right? So defense mechanisms, this is allowing individuals to resolve the thoughts and feelings, to resolve those to resolve those conflicts, right? So it can be a healthy way to adapt in terms of humor and altruism. And what altruism is, for those that don't know, is going to be a way for you to do something for someone else without receiving anything in return, right? So when you give a gift without expecting that person to gift something to you back, right? So you're honestly just doing something out of the goodness of your heart to help somebody else in their time of need or in their life, all right? Some unhealthy ways of dealing with this, we'll talk about in a little bit, is kind of the self-destructive phases. So the negative self-talk, throwing yourself in depression, utilizing drugs, alcohol, sex, whatnot to cope with that. When you're really not coping, you're just trying to push the emotion to the side and distract yourself with something else. All of the studies, the majority of the studies that we look at in terms of healthy psychological well-being, is that you find safe and healthy ways to be able to approach those emotions and feelings and to truly deal with them instead of going around them. We know that going around them and avoiding them never turns out healthy in the end. All right. So other different types of coping mechanisms, these are more of the negative ones. So projection, if you have that individual that is consistently projecting things onto you, let's say there's a certain situation that you're dealing with and they say, well, you shouldn't do this, you shouldn't do this, you shouldn't do this. It's more of a projection of their personal internal environment being thrown on you. And parents can do this, right? Just because you're an adult doesn't mean you don't do this to other individuals. There are certain life experiences that maybe could be negative, and now other people are projecting that onto you. One that really comes to mind is starting a business, right? Maybe you know that individual, or that individual knows some individuals who started businesses. Maybe it didn't work out, and you mentioned you want to start a business, and all of a sudden is this can happen, this can happen, this can happen, don't do this, right? They're projecting their life experiences onto you. It doesn't mean that that's going to be your life experience, right? But there's a different way that you can actually communicate that to the individual, right? Repression, we talked about going around or pushing to the side the emotions. We know that repressing the feelings, repressing the emotions generally don't work out very well. There are some therapeutic and psychological techniques that you can use to take a memory out of your awareness. Personally, I don't feel that that is something that can be beneficial in the long run. But it's up to you in whatever treatment you want to do. Just make sure that you go to someone that is licensed, that is experienced in working with patients. All right. Denial is another one. We know that there are stages of grief. One of those stages is denial, right? If you're dealing with something traumatic, someone dies or whatnot, not acknowledging the fact that you feel that way can be more detrimental, and it can make those emotions feel more intense than what they actually are. And I'm not trying to negate the fact that you have feelings, but if we put ourselves in a situation where we're denying the fact that we are angry, we're denying the fact that we're sad, then we're not going to take the steps it needs to utilize the tools to help us deal with that. All right. So jumping down the list, substitution, we talked about distracting ourselves with either drugs, sex, alcohol, whatever it is, right? Acting out, we see this a lot in children where there's something traumatic going on at home. Maybe they're being abused physically or verbally, and that starts to carry out in school with other school kids, all right? Again, some of the healthier ways to be able to cope, humor, right? Altruism, a lot of studies really show that altruism or doing something for someone else can be just as effective, if not more effective, in pulling an individual out of depression as any type of medication or pharmaceutical would. All right, so keep those in mind. All right, so optimism, honesty, and loneliness. Now we're going to get to kind of the brighter things of psychology. We've kind of talked a little bit about the science. Again, if you have questions, please feel free to let me know. Just shoot me an email, and I'll make sure to answer that for you. Being optimistic is going to look at the favorable things in a situation and having hope in that situation versus looking at the negative and unfavorable things. And a lot of times in life, especially if you live in a lower income area or you've grown up with less, you are going to experience those individuals who look at every life experience as a negative. You're going to look at all the things you don't have versus looking at the things you have, right? If you look at the fact that you have clean running water, if you look at the fact that you have light, you have heat, you have clothes that can keep you warm, focusing on those really starts to change your perspective in terms of, my life really isn't as bad as I'm thinking. But if we're consistently focusing on the negative, then that's all we're going to see, and that's where our mindset is going to go. So optimism can be learned. There is some thought out there that says if you're a pessimist, you're always a pessimist. If you're an optimist, you're always an optimist. That's not true. We know that the brain is moldable. We can learn new things no matter how old we are. So optimism can be learned, but it's a practice, right? It's not going to happen overnight. It's going to be something where you utilize these tools over and over and over again, and eventually your mindset will change. You just need to take that time in order for it to happen. All right, maintain honest communication. So assertiveness. Being assertive doesn't mean you're bossy. It just means that you're expressing in a non-hostile way your viewpoints on a situation. All right, so you can be assertive and positive or optimistic, or you can be assertive, right, forceful, and create a hostile environment. So that emotional intelligence textbook 2.0, that can really, really help you with that. All right, and dealing with loneliness. We know that with the advent of social media, numbers and reports of loneliness has actually increased. If social media is supposed to connect us more, why is it making us feel more alone, right? And a lot of science is gearing towards the idea that the communication or the connection that we have with social media really isn't a true connection. It's a pseudo connection. It's a fake connection, right? The chemicals only get released when we're face to face with that person, when we're interacting in a physical aspect with that individual. All right, so discovering how to enjoy others in a true fashion, and also discovering how to enjoy being by yourself, right? Those that are single children or only children, you eventually will start to get this. I was an only child until I was 7, so I really learned how to be happy by myself. But other individuals who haven't been in that experience generally don't really know how to be happy by themselves. So again, this is where it's important to really take quiet time for yourself, and meditation is a really, really good tool to help you do that, to kind of ignore the external and to really take time to yourself and learn how to be happy with yourself and learn how to be happy bored, right? A lot of individuals cannot be bored nowadays. You see people at the bus stop on their phones. You see individuals walking down the street on their phones or being distracted by something. Learn how to be bored and learn how to be by yourself, right? That's going to come with that self-love. All right. So next one, anger. There are a lot of individuals that are dealing with anger, especially with the increase in stresses in life. That anger is an emotion that can oftentimes be put into our existence. But please keep in mind that if you experience anger, or if you experience sadness, or you experience a certain emotion, understand that it's an emotion. It's fleeting, right? So that emotion comes and goes, right? The values, who you are, that's going to stay, all right? But if you are angry, or you notice that you're angry a lot of the times, don't identify yourself as an angry person, right? That's just an emotion that you experience, and we have to figure out why you're actually experiencing those, so then we can replace that with a more pleasant emotion like joy, happiness, or humor, right? So at one extreme, individuals who are angry are people who have a great trouble expressing anger, right? So the way that some individuals will express anger is they'll physically take it out on something, or they'll verbally take it out on someone, right? Again, that anger is coming from somewhere. So similar to medicine, we want to find the source of that, so then we can deal with the symptoms, or we can deal with the outbursts of that anger, all right? So there is a signal, or there's a condition called intermittent explosive disorder, so IED, all right? And I actually had a student that had this, and her trigger was tapping of pens or popping of gum, right? She didn't understand why it made her so mad. So in the health realm, we would try to look back and see what are some triggers that could be setting that off, but she just knew that anytime someone did that, it would just bring up intense anger. So what she did with the counselor was she found ways to be able to cope with that. If you do hear the tapping of pen, how can you, in a healthy manner, address that source or address that situation, and then how are you going to deal with the internal anger that was brought up? Again, disassociate yourself from that emotion. That's not who you are. That's just something you're experiencing temporarily. An emotion, again, is fleeting. So that emotion is going to leave at some point. You have to try your best to not attach yourself to that emotion, and kind of picture it as a balloon, right? You're going to release that balloon. You're still who you are, but that emotion is now gone. All right. So psychological disorders, we're going to talk about anxiety, mood, and schizophrenia. Again, just because you have a psychological disorder does not mean you're crazy. Just because you don't have a psychological disorder doesn't mean you're normal, right? It's just who you are, and it's the mental state you're currently in. You never know if a situation is going to come into your life and how you're going to react to it. We may think we know how we're going to react to it, but until that situation happens, you never know what's actually going to break you until it actually happens and breaks you. All right. So again, we don't want to judge other individuals. We just want to try to help and understand where their mental mindset and where their experience and where they're at as a person, right? Have that empathy. All right. So when emotions or irrational thoughts interfere with daily activities, they start to rob us of our peace of mind, right? They could be categorized as some of these, but these are just general factors, right? We know that if you get that bad grade in class, of course that can help rob you of your peace of mind, but how are you going to cope with that? How are you going to deal with that? That's what we really want to focus on. All right, back to the science a little bit. Let's talk about nerve cell communication. All right, when it comes to nerve cell communication, we do have electrical and chemical messages that send the signals or that communicate, right? So on the screen, if you notice, there are neurons, we have synapses. What's really important is to understand that the feelings and emotions that we have, science has been able to track it back to neurotransmitters and receptors. And if we change the chemicals, if we change the balance in the mind, then we can effectively change the outcome, and we can change what the person is experiencing, right? Back in the day, what they tried to do was cellular damage. They would do lobotomies. So they would stick a scalpel through the nasal passage up to the frontal lobe cortex. And they essentially did this for very violent criminals. And what they found was, as they scraped the frontal lobe, the individual would become less violent. Little did they know was that what they were doing was they were really messing with their emotional sensors, and they were essentially making the individual like a zombie, right? So there was really no emotion. So there was no outburst, or there was no violent acts or once of violent acts, because those cells that would originally accept those signals were gone. All right. So looking at the science of it, if we know that we can trace back our mental health to different chemical and neurotransmitter relationships, then we know that there are ways for us to change those, especially hormonally in the body. And we'll talk about how hormones play a huge role in that. All right. So understand that nerve cells are neurons. They communicate through a combination of electrical impulses, right? We have chemical and messages that can be sent, such as serotonin. Serotonin is a big one, right? Norepinephrine is another one, right? So overall, it's going to be that response that is going to identify or depict our mood. It's going to identify or depict our attentiveness. And it's going to identify and depict our psychological state. All right. So anxiety disorders, we'll focus a little bit. So anxiety, it's a fear that is not in response to any definite threat. So anxiety disorder and anxiety attacks have been on the rise, especially since I started in sports medicine. I've really seen a huge increase. First couple years, maybe I had 2 patients that really experienced that, and now I have at least 10 a year that come to me actively having anxiety attacks. So the science behind where it's actually coming from is still developing, as with most science, but we know that the definition can be agreed upon, right? It's a fear that's a response of something that's not actually happening yet. So if you are going to jump out of a plane, right? You haven't jumped out of the plane yet, but for whatever reason, 2 weeks before, you're starting to feel anxious. You're starting to feel that. You're not up in the air. You're not standing in the plane. So why are you feeling anxious? And again, it all starts in the mind, right? You mentally put yourself in that situation, so your emotion and your moods are actually going to follow, all right? And that's empowering to know that, because now we know that there are ways that we can actually mitigate that and ways that we can actually cope with that in a healthy manner, all right? There are social phobias, right? A lot of individuals have that, especially when it comes to public speaking. Thankfully, my mother was able to give me tools to be able to deal with that, so I don't have an issue with public speaking. But the fear of embarrassment while being observed by others, that can be something that can start to bring up anxiety. And again, once it starts to affect your daily life, let's say you're worried that people are going to make fun of you, so you don't even exit your house anymore, right? That means you're cutting off social interactions with other individuals. You're not getting the benefits of nature and sunlight and being outdoors like we were created to be, right? So we want to pay attention to those behaviors, right? Panic disorders. This is a sudden, unexpected anxiety attack, and most individuals will know this, an anxiety attack. So agoraphobia is one of those panic disorders that we can see. It's the fear of being alone or away from help, right? So you're in your house by yourself and you consistently have anxiety that you're going to fall, you're going to break a hip, you're going to have a heart attack, your cat's going to end up eating your face, whatever, right? We have panic attacks, which we know is, again, on the rise. So it's a brief surge of overwhelming anxiety. Again, it's coming from something. And talking to most of my patients, I've noticed that where that anxiety comes from is the feeling of lack of control. They feel like they don't have control with their external environment or whatever situation is happening. So that panic and that overwhelming anxiety starts to build. As it builds, now physiologically we're seeing changes. We're seeing an increase in respiration. We're seeing an increase in blood pressure, an increase in pulse rate, right? The individual can start to feel like they're going to faint. So again, that mental state, what you're doing in your mind, controls physically everything else, all right? We have GAD disorder, which is generalized anxiety disorder. This is just an uncontrollable worry about an excess of things, and oftentimes in high school, especially with grades, college, scholarship letters, your parents' demands, getting a job, right? You can feel like there's a multitude of issues coming at you, and you can start to feel overwhelmed with that. So again, mentally, what are you doing to cope with that? There is OCD, right? Some individuals will self-diagnose themselves as OCD, but this is really a reoccurring of senseless rituals, right? So you lock the door once, you know it's locked, but you go back and you check 4 or 5 times, right? It doesn't actually change the fact that the door was locked. The door has always been locked. But now we're creating a ritual where every time you lock the door, you have to check it 5 times. Or every time you turn on the water to wash your hands, we have to turn it on and off 3 times, right? So when you have repetitive compulsions that make it difficult to perform certain actions, or you start to obsess about things, and rumination is something that a lot of individuals are becoming very accustomed to. You make a mistake in life and you start to ruminate over and over of that situation and how it ended up. There's one thing to go back and to learn from a situation, but there's another thing to go over and over it in your mind and expect a different result, right? Einstein said the definition of insanity is doing something over and over and over again and trying to expect a different result, right? So when we have unwanted thoughts or impulses, there's ways for us to cope with that, but you have to understand that you need to disassociate yourself from that, because a thought is a thought, right? Again, there's a lot of external cues, and there's a lot of external information that's coming in at us. And so oftentimes if you're hanging around individuals and maybe they have a more negative, violent mindset, you may have those thoughts come into play, right? But again, that's where we can have control over that, is who are we hanging out with, right? You don't have to hang out with those negative individuals that have violent, I guess, impulses, right? We can start to put ourselves around individuals that don't have those violent impulses, and it's amazing to see how your mindset will change when you change who you're around, right? And in high school, actually at any point in life, you have the ability to be able to control that. That's one thing you can control, is who you're around, right? So really start to look at those relationships and really start to see, who are you influenced by, and is this actually something that's going to benefit you? All right. We have PTSD. We know, again, that's on the rise, especially with the recent war in the earlier 2000s, right? We have individuals that have been in traumatic situations and they're having flashbacks or even hallucinations of those events. 4th of July is a big one for some individuals. They've been in war, and with the fireworks going off and explosions, it kind of brings them back to that time. So when it comes to PTSD, if you feel that you're starting to struggle from PTSD, please go seek professional guidance and help, right? Because there are different ways that you can help to cope with that. Some ways that are used to treat are medication. Again, if you know me, I personally don't believe in medication as a first go-to. But there are also other psychological interventions that can be utilized. And again, we'll talk about that in a little bit. All right. So ADHD, we know little fidget spinners that were actually developed for individuals with ADHD. It's going to be a hyperactive disorder, and we notice that a lot of individuals are going to be diagnosed when they're children. The issue with the diagnosis as children is that kids are kids, right? Especially when it comes to boys. You can't sit them in a seat for 6 hours a day at school and expect them to behave, because the goal of a child is to explore the world, right? So we can't have them sit like an adult would. An adult's already explored a lot of the world, but a child needs that creativity, they need that imagination, they need that physical outlet to be able to understand themselves and understand the world, right? So individuals that have been diagnosed with ADHD have been put on medication, and a lot of those individuals, as they got older, they report the feeling of being in like a zombie-like state where they just had no emotion, right? They kind of felt in prison. So we know that medication necessarily isn't the best outlet for this, right? But the way that they're going to diagnose this is different persistent patterns of behavior, right? Behaviors that are going to interfere function and development. Normally the symptoms are going to arise before age 12, but from the research that I've read on it, as a child, you really want to monitor them and see them to see, do they really have ADHD, or are there tools that we can provide to them? Is there a way that we can change their schooling, or is there a way that we can change their daily routines that can benefit them more so in who they are as a person, how they want to explore the world, versus just trying to put them in a mold and telling them to stay there. All right. When it comes to mood disorders, these are going to be emotional disturbances that can persist and affect normal function. So again, all of these things are affecting your normal function. Just because you have a thought or you have a disturbance doesn't mean you have a mood disorder. It doesn't mean you have ADHD, right? Disassociate yourself from that and understand that, yeah, I have this thought, but is it affecting my daily life, right? When it starts to affect your daily life, that's when we want to bring more attention to it, and we want to seek professional help for that, right? There's two main types of mood disorders that we see that are most common in the United States: major depressive disorder and bipolar disorder. There are studies that are suggesting that bipolar disorder can come from frontal lobe damage or damage to the frontal lobe due to either hitting the head or whiplash or whatnot, to children that can start to develop that later on in life. All right. Depression is going to be a big one. We hear commercials all the time. If you're experiencing depression, get this medication or contact your physician or whatnot. If you're experiencing true depression, you do want to seek out help, but keep in mind that it's going to be characterized by a series of symptoms, right? So loss of interest in just general activities or things that you used to like to do, sadness, chronic hopelessness, loss of appetite, disturbed sleep, other physical symptoms, right? You start to physically lose weight, you start to lose your hair. There's a lot of things that come with depression, and it's so interesting that something that mentally is happening to you can physically start to show, right? So it strikes nearly 6.7% of Americans annually, and these are diagnosed. These are not self-diagnosed. So these numbers are coming from individuals that have actually gone to seek professional help from a psychologist or a psychiatrist, all right? Treatment depends on severity. So just because you've had a bad day doesn't mean you're depressed, right? This is going to be these characteristics that are going to be chronic, that are going to be ongoing, right? So you've been dealing with this for a long time, and now it's starting to affect your daily activities, right? Drug therapy is generally used, but we have a lot of studies that are showing that altruism, or getting outside of yourself and doing things for other individuals, like I said earlier, can actually combat the physical and the mental signs and symptoms of depression, sometimes better than actual medication, right? And we know that there are certain medications that can throw us into depression, all right? So what we're kind of getting away from is the idea that depression is solely a chemical imbalance, and we're more so looking at the body as a whole and seeing that depression can come from a multitude of different areas, not just because your serotonin levels are low, all right? So there is electroconvulsive therapy, or ECTE. This has been shown to be effective for individuals with severe depression, right? When other approaches have failed. So again, this is a last resort type of thing to help the individual. If we've truly tried everything, then we shouldn't have to get to this state, all right? There is SAD, which is seasonal affective disorder, and this is depression due to lack of light. So states like Washington, where there's more cloud coverage more times of the year than not, we've seen that light therapy is actually beneficial. And we understand that light therapy, there's really no negative side effects of that unless you're sitting in the light for an extended period of time and you start to get skin damage, right? But that's why it's so important, especially for those of us that live in places like Southern California and Florida, where we have a lot of sunlight. Get outside, right? Get that exposure. 20 minutes a day is not going to give you skin cancer, right? Unless you're on the equator where the sun is super intense, right? Then we want to adjust those times. But if you're fairer skin, maybe aim for 5 or 10 minutes. If you're darker skin, aim for 20-25 minutes. But there's a chemical reaction that happens when our skin is exposed to the rays from the sun, and it's a great chemical reaction. That's how the hormone vitamin D is able to be developed. And we know that vitamin D, all kinds of it, all the different kinds of vitamin D, those are very important in terms of body function because it is a hormone, right? So it is going to control a lot of your physiological chemistry and aspects, right? So it's something that's free, it's something that's simple. Just get outside and get exposed to sunlight, right? Roll up the sleeves, wear some shorts, expose yourself, because your body really utilizes that light therapy as a great benefit for you. All right. Next one, bipolar disorder. We talked that some studies are suggesting that traumatic frontal lobe damage has been linked to bipolar disorder, but this is going to be expressed as depression and mania. All right, so mania, for those that don't know, is going to be excessive inhalation, right? Or there's going to be a lot of irritability, or all of a sudden someone's really, really talkative, or they have an inflated self-esteem and they just think that they're king of the world, right? So it's going to be going from that down to depression, down to the negative mindset, down to there's hopelessness, I have nothing to live for, etc. And it's going to be varied. So some days they may be very manic, some days they may be very depressed. It really depends on the level of it. But in the more conventional methods, there's been drug treatment that's been prescribed, but we know that there's a lifelong treatment. And if the toxicity from the pharmaceuticals is going to cause other health issues, why not try other methods first to see if that actually benefits and improves the quality of life for the individual? All right. Schizophrenia, this can be a very devastating mental disorder. There's still a lot that's being learned about it. So don't think that if you experience any of these characteristics or you exhibit any of these characteristics, it means that you're schizophrenic, right? This should really be something, all of these mental disorders should really be something that's diagnosed by a professional that knows what they're doing and has the proper education working with these individuals, right? So the generalized characteristics, and again, if you experience or if you exhibit some of these, doesn't mean you have this, right? But if you're truly concerned about it, go ahead and seek that professional help that you need, all right? Disorganized thoughts, right? Inappropriate emotions or absence of emotion, right? Delusions, firmly held false beliefs. So you truly feel like you're a piece of crap when everything shows that you're not, right? When your characteristics and what you're doing for other people show that you're not. Also, let me get my battery. Also, we can see that in terms of holding on to false beliefs, you can believe that everyone's making fun of you, and that's absolutely not the case. Maybe no one's even talking to you, but you're still feeling that way. You're still getting that idea or that mindset. Auditory hallucinations, so you're hearing things that aren't there, right? That's going to be more of a more severe type of general characteristic. Also, deteriorating social and working functions, right? So now you don't go around people. Now you start to avoid social situations because of whatever you're thinking or feeling, all right? Because of the risk of suicide, professional help is definitely needed. So again, like I said earlier, if you feel like you're really exhibiting some of these characteristics, go seek that medical help that you need. Go seek that professional help that you need, all right? These are just a little stats for psychological disorders amongst Americans, and something that is very interesting about this is that we really see that specific phobias, especially for women, are pretty high. We don't know why yet, or I haven't ran across the research as to why that is. We do know that when it comes to brain development, there's a difference between men and women, that women brain development tends to happen faster than men brain development. So this could be a reason for the skewed numbers. But again, it's just interesting data to actually take a look at, to see how many individuals are actually suffering from panic disorders, from social phobias, generalized anxiety disorders. When it comes to generalized anxiety disorders, we see it's pretty consistent between the two. There's a couple % difference, but we see that both men and women experience this. And this could, again, like I said earlier, allude to the idea of our social and cultural expectations and what our workplace is expecting of us, what our parents are expecting of us, what our children are expecting of us, etc., etc. All right. One technique that I really like to utilize is called EFT. It's going to be emotional freedom technique. And I'm the type that's had issues in expressing myself in an emotional fashion. It's not because my mom didn't teach me to do that. It's because I felt that I needed to guard myself so I didn't get hurt by other individuals. Right? But tapping is a really good way to internally accept those emotions. So there's a couple different tapping areas that you utilize. They're called acupressure points. All right, one is going to be on the head, there's one on the shoulder, there's one underneath the armpits, there's several on the face, right? So with this technique, what you're going to do is you're going to not only tap, but you're going to verbally respond to yourself. And let's say I'm in a situation that's making me feel very, very sad, right? First thing to keep in mind, is that the emotion is not who you are. It's what you're experiencing, right? So by tapping on these multiple points, and you can tap about 5 times on each point, as many times as you need, right? You'll tell yourself, it's okay for me to feel sad. It's okay for me to feel sad. It's okay for me to feel sad, right? So as you're verbally saying this out loud, and as you're tapping on these different acupressure points, you're starting to really dissociate yourself and to really change your perspective on how you're looking at that emotion. So again, instead of saying that that emotion is me, you're saying, I feel this way, or I'm experiencing this. So then you can change your mindset and your perspective to be able to go ahead and let that go when you're ready to let it go. You may not be ready to let it go immediately. You may do a couple taps and you're like, oh, okay, I'm good. And now you can think rationally about the situation instead of reacting in an emotional response. All right. And that goes into taking that quiet time for yourself and knowing yourself. So if I know myself and I know that I can explode, or I have the potential to explode at the drop of a hat, and a situation is arising where I'm recognizing that emotion, I go ahead and tell the person, I need just a 5-minute break. I will be right back. I go by myself and I tell myself, I'm experiencing this anger. It's okay for me to feel angry, right? But also tell yourself, it's okay to let this go. It's okay to let this feeling go, because I am not this anger. I'm experiencing this anger, right? So a really good technique, and again, it's free. It's something that you can do anywhere, right? And a lot of individuals have really been able to see beneficial shifts in mindset and psychological wellness due to it. So EFT, if you haven't tried it out. All right. When we come to suicide, right, this can be kind of a dark subject, but we don't want to ignore the fact that this happens, right? So in the U.S., suicide is the second leading cause of death for young people ages 15 to 34. And again, this is due to stats that were able to be gathered. We know that there are individuals who unfortunately do take their lives or attempt to take their lives that no one really knows about. So this is just the data that we've been able to gather, but this is even too high of a rate, right? 0 is going to be the perfect rate, right? But since we know that everyone is different, let's provide some tools and techniques to help individuals understand that if you're experiencing something, you're experiencing these thoughts, there is help that you can get, and it's not taboo anymore to go get that help, right? So signs that an individual may be suicidal: any mention of dying, disappearing, or self-harm, right? We know that especially in the middle school realm, this is kind of becoming not so much an epidemic, but an issue in terms of individuals cutting themselves. And from the individuals that used to do this, that I talked to, they mentioned that they did that because they just didn't feel anymore and they wanted to feel something. So that was their way of feeling, right? Changes in personality, sudden or unexplained brightening of mood, right? They've been super sad, and all of a sudden they're super happy, right? A sudden move to get away from or to give away important possessions. If you know an individual that is starting to give away sentimental things and personal things, and it looks like they're kind of setting up the end of their life, that's something that you really want to take a look at, right? And an increase in reckless behaviors. They start to dabble in drugs, they start to dabble in a lifestyle that's very dangerous, right? They get involved with individuals that could put their life at risk. These are going to be behaviors that we want to see. And the only way that we can really see this is having those personal interactions in person with individuals. When it comes to social media, that's everyone's highlight reel, right? People want to put up the best things that are happening in their life. But if you have a friend and you start to notice these changes in personality, really take that serious. We don't want to just throw it by the wayside and think, oh, they'll get over it, right? Maybe this is their way of calling out for help from you, right? Key risk factors for suicide: history of previous attempts, right? One of the biggest misconceptions is that, oh, if they really want to kill themselves, then they're not going to say anything about it. That's absolutely false, because again, that could be a way for them calling out to help from someone, right? We just have to be aware and be able to pay attention to that. All right, sense of hopelessness. Most individuals who report attempting to commit suicide or have left letters after suicide have reported a sense of feeling hopeless, right? And we talked about being hopeful, right? Having that optimistic mindset earlier. So if hope is going to be one factor that either contributes to suicidal behavior or helps someone not become suicidal, right? We really want to focus on developing that positive and optimistic mindset in our youth and in ourselves so we can combat one of these risk factors, right? If someone could tell you that in order to decrease your risk of a heart attack, don't eat bacon every day, right? That's something we can control, right? There are tools that we can utilize to not eat that bacon. So why would we not utilize these tools to control our mindset, to control the optimism and the positive and the hopeful feelings that we can get, right? Alcohol or other substance disorders, serious medical problems. Jumping down, history of abuse or neglect, right? We know that there is a famous study that says if you want to develop a serial killer, neglect your kid for the first 6 months, right? We need that human interaction. I can't express how important the positive and healthy human interaction is, especially with developing individuals, right? Current or past experiences of being bullied. There is increased reports of school shooters. Those that were the school shooter, they have a history of trying to commit suicide themselves prior, but they weren't successful. They weren't able to do it. So their way of getting themselves out of that hopeless situation of either being bullied or experiencing abuse or whatnot is to create a situation where someone else is going to have to kill them for them. All right. So in school especially, if you see something, truly and honestly say something. Don't be one of those a-holes that kind of just stands in the back and observes, right? Because this individual could actually need help. We all need to start to get outside of ourselves and understand that the world is bigger than us. It's bigger than the little world that revolves around us, and that we have an impact on other individuals with our actions and our words, and that there truly is a ripple effect with what we do. Whether you like it or not, you're an example and you affect somebody's lives. So please keep that in mind. All right. Key protective factors. So we know the risk factors. There's a whole list of risk factors, but a lot of those can be controlled, right? The positive factors that we can control: strong religion, faith, or cultural prohibition on suicide, right? There are some religions that suggest that suicide is a sin, right? I wouldn't necessarily put that negative connotation on that, but we do want to understand that as long as we have an individual that feels that hopefulness, right, that has an optimistic mindset, a lot of these risk factors are negated, right? Engagement in treatment. If you truly feel like you are having suicidal thoughts, or you know someone that's having suicidal thoughts, go talk to someone about that. Seek that professional help, right? Connection with children or pets. Pets have been used as a big time rehabilitator and a way to help individuals get out of their mindset. If you look at animals, a lot of them are going to be pretty selfless, right? Especially dogs, right? That we keep in the household. So again, getting outside of yourself. There's one story that a little girl, she got into the habit of delivering socks to homeless people. So if she had a bad day at school, or let's say she got a bad grade, she'd go home and she'd tell her mom, I need to go on a sock run, right? And her mom and her would literally go around to the homeless community and they would give socks. Because a lot of people don't realize that homeless people need a lot of things, but it's the simple things that they really enjoy, right? And having socks that are dry and fresh, those are huge, right? So what she would do is she would go on a sock run, and she noticed that that would actually bring herself out of it. So she started inviting friends to go along with this, and it all goes back to what can you do for someone else? Quit being so selfish and into your own self, right? Because that's what can kind of bring you into that depressive state. Pull yourself out of it and do something for someone else. Again, there are studies that show that doing something for someone else is just as effective, if not more effective, than medication mediation when it comes to depression. Right? So why could we not use this for other mental disorders as well? Right? Encourage a person to talk. That can be helpful, right? Just having someone vent and truly being a soundboard. Please don't throw a, well, at least this didn't happen, or at least this didn't happen, right? Just truly be a soundboard and just listen to them and say, wow, that sucks. Or I'm hearing you, or I understand what you mean by that, right? They just want to see that they're not alone, all right? So different percentages, Americans 18 and over having those suicidal thoughts. It really doesn't matter the ethnicity. We know that these numbers are still way too high. So when it comes to us as a culture, we really want to be empathetic to other individuals, to see where their mental state is. And if they are going through something difficult, let's not judge them for it. Let's try to do the best that we can to be able to help them. And if we don't have the resources to help them, let's go ahead and connect them with someone that has those resources. And we know there is a suicidal hotline that can be called, so you can go ahead and look that number up. If you truly need help, or if someone you know needs help, have them call that number. There are a lot of great resources, and there are a lot of very educated and trained individuals that can help with that. All right. Different myths about suicide. We talked about some of the different myths. Again, an individual may not always keep it a secret that they want to commit suicide. They may actually verbally say it, but again, it could be a cry for help from them, right? People inherit suicidal tendencies. That's not always true. You can grow up in the biggest mansion with the most money and the most cars and the most opportunities, but still commit suicide. I mean, a big one is, what is his name? Robin Williams, right? Comedian, made multiple people laugh, but ended up committing suicide himself, right? So we know it doesn't matter how much money or success or how popular you are, you could still have these ideas and these thoughts, and it's important to seek help and be honest with yourself about those, all right? Another one is that all suicides are irrational. That's absolutely not true. There are some very level-headed individuals that have taken their own lives, and again, it goes back to that feeling of hopelessness and being alone and feeling like there's nothing they can do with that situation, all right? So be empathetic to other individuals. Models of human nature and or modes of human nature and therapeutic change. There are different biological models, so this is kind of where we're going to get into the science a little bit. There are issues with drug therapy. So in terms of mild cases of depression, psychotherapy can be a little more effective than actual drug therapy, right? When it comes to moderate or severe depression, a combination of those could work. But again, realistically in the research, what we're seeing is that there's more negative side effects to drug therapy than there are positive. Every case is going to be individualized, right? So again, go to an individual that is licensed and trained in doing this. But we know that there are more natural remedies that can be utilized to try to combat this chemical imbalance. And one of the big ones is the gut to brain connection, right? We know that when it comes to the brain, that the gut is now being considered the second brain because there's so many chemical mediators and there's so many neurotransmitters that come from that area due to whatever the gut bacteria is. All right. So before we leave this slide, pharmacological therapies, there's antidepressants, there's mood stabilizers, there's antipsychotics, there's stimulants. There's a lot of toxic things that we can utilize to try to help us with these mediators. And again, every case is going to be different, really depends on the practitioner that you go to. But if we have natural remedies that are free and can be useful and that science has shown can work, why not try those before we go straight to drug therapy? All right. When it comes to the gut-brain connection, I left a resource of just one of the studies that's been done at the bottom of the slide if you'd like to go check that out. This study in particular was done on the gut bacteria of rats. And so what they did was they looked at rats that experience or that express different characteristics in being depressed. And they took their gut bacteria and they transferred it into rats that didn't express those different characteristics of depression. And they found that as they transferred that gut bacteria, the rats that generally weren't depressed ended up starting to express those different types of characteristics of depression, right? So we don't want to just completely throw this science away because there are a lot of studies that are really supporting that the bacteria that's going on in your gut that really has a true effect over your mood, right? And we have those case studies where individuals have been on drug therapy for years, right? And one clinician or one practitioner or one physician was able to find that they had a lack of a certain type of vitamin or mineral, right, in their gut. And so once they started replacing that, then we noticed that the mood started to elevate and they started to come out of that depression. So really look into this type of science. It's something that's definitely growing. We still need more research behind it, but it is promising in terms of understanding that the body is a total connection with itself that we can't really diagnose and treat in sections anymore because everything communicates with every other aspect. For example, gut to brain. All right. Behavioral model focuses on what people do. So when it comes to behaviorists, and you can become a behaviorist if you really want to, it's going to analyze the behaviors in terms of stimuluses, responses, and reinforcements, right? So we know that science is showing that positive reinforcement is going to be a more beneficial method of a change in behavior versus the negative reinforcement, right? But we want to pay attention to what the cognitive model says, and it's going to emphasize the effects of those ideas and behaviors and feelings, right? So whatever the individual is exposed to, that's generally the types of characteristics that they're going to start to develop, right? We want to ensure that whatever words we're putting out and whatever vibes, if you will, that we're putting out is going to be something that is not harmful to others, but it's going to be something that's very beneficial to others. So very much having that self-awareness and paying attention to your words and your actions are huge, right? Psychodynamic model also emphasizes thoughts. So thoughts are going to be something that's huge. And meditation is one thing that is very effective and that we've seen in research that is very effective in being able to control those thoughts, right? Being able to look at the complexity of wishes and emotions and looking at the actions and behaviors that actually come from that. All right. Fearful people are taught to practice exposure, right? So when it comes to that therapeutic change, if you have an individual that's afraid to go outside, one way that we can combat that is to expose themselves to the outside. But again, you want to do this in a very safe manner. So when we're talking about different therapeutic changes, make sure that you're working with an individual that is licensed and trained to actually do these things. You don't want to just go to your lay person and just do whatever they say, because they really don't have the clinical backing and the patience to show that what they do actually works. Right, so research who you go to. All right. There's different evaluating models that can be utilized. Cognitive behavioral therapies can be utilized. There, again, are drug therapies that can be utilized with that. There's psychodynamic therapies that can be utilized with that. So it really depends on the individual, and it depends on, one, what they're going through, what they're dealing with, and two, what is the best approach for them. If you have an individual that's experiencing schizophrenia, but they have a very optimistic mindset, they're going to have to, or they're going to utilize different tools and techniques versus an individual that maybe is experiencing depression and they have a very pessimistic mindset. Right? So it's very individualistic. We can't do a one-size-fits-all when it comes to these therapies, but that's the point of the therapies, is that we have a lot of different options to be able to use with our different patients, because again, everyone's different, so please don't treat everyone like they're the same. All right. Other psychotherapies, so dialectic behavioral therapy, or DBT, this is one that's actually coming into play a little more, into the cultural consciousness a little more. So I left 2 books for you on the slide that you can go ahead and check out if you really want to learn more about it. But it's really a behavior therapy that encourages a distress intolerance and accepting the painful feelings through mindfulness. So we know that meditation is very good at getting you to practice that mindfulness set, where you can be by yourself, you can be in an environment where you're alone, and you really train your mind to focus and be mindful in the moment. All right, and that's what a lot of individuals are lacking. We're constantly in the past, or we're constantly in the present, when the only thing you can actually control is in your presence. All right, you can't control what happened back then. You can't control what's going to go on in the future, right? All you can control is where you're at now. So it's really training the mind to be able to focus on being present and being mindful and dealing with whatever is right in front of your face, whatever situation that you're dealing with in the present moment, right? So there's different levels to it, right? First one's going to be mindfulness. Again, meditation is a form that can be utilized for that. We're going to look at distress tolerance, right? So we're going to look at different ways that we can actually identify these feelings, right? We're going to look at emotional regulation. So after we identify these feelings, right, we know that we're feeling sad, we know that we're feeling angry, and we understand not to associate ourselves, rather disassociate who we are value-wise from those emotions. Now we can work on the emotional regulation of it, right? And then we can go ahead and move on to the final step, which is really looking at that personal effect or interpersonal effectiveness, right? How are we going to be able to communicate with our external relationships after we've figured out our internal relationship with ourselves? All right, so check those resources out if you'd like to. All right, getting help. This is huge, right? Self-help, understanding how to identify what you're feeling and identify some of these characteristics, and going and getting the help that you need, right? First thing, education. If you learn more about whatever it is that you're dealing with, or if you learn more about something, then we can start to have action behind it, right? Some individuals say education is power, but I feel that education is potential power, because again, we have to have action behind it. It's not enough to know how to make $1 million, but it means everything to actually put the actions behind it to go and make that $1 million, right? So you guys, by the end of this lecture, know about these different mental and psychological illnesses that can affect a lot of individuals, but now we have to put the action behind it if we ourselves are being affected by this, or if someone else that we know is being affected by it. All right, writing a journal can help with coping, right? One that I do suggest is a gratitude journal. And again, it's free, right? Unless you want to get fancy with it, and then you can go buy one of those nice journals. But writing down what is going on internally can help. Also, writing down what you're grateful of, right? It kind of puts it into that cognitive awareness that we have so much that we should be grateful for. But sometimes in life, we really don't take the time to really express that. All right, so writing those things down. Also, religious or spiritual beliefs, practices, those can help some individuals, right? Peer counseling or support groups. There's a lot of different support groups, and you yourself could actually start a support group, right? If you just find an individual who is knowledgeable and experienced in whatever it is that you're dealing with, guarantee there are other people that are dealing with it. Don't make it seem like, or don't feel like you're alone in this. There are other individuals that are feeling this, but you just have to be aware of that. And it helps to kind of put yourself out there and get around other individuals that are experiencing what you're experiencing. Because again, it takes away that idea of being alone, right? It brings that idea of togetherness, that I'm not the only one going through this, right? There are online help, there are apps. If you truly feel like that there's something that you're struggling with, or someone else you know is struggling with, find that professional help, and there are a lot of resources for that. All right, we already talked about professional help, especially being in a school, right? There are some mental health individuals that can help you on campus. All you have to do is contact your counselor, make an appointment. Same with college, contact your counselor, make an appointment. There are hotlines that you can call. There are websites that you can go to that have support groups and support forums. So if you're not physically around someone, it helps to at least be able to chat with someone that has dealt with what you're dealing with, or is currently dealing with what you're dealing with. And you can share different ways of how to cope with that, right? So the whole idea of this is finding tools that can help us to be able to cope with that, right? Not shaming ourselves into feeling bad because we're feeling this, but finding empowerment in the resources that we actually have available to us, right? Alcohol and drugs, those are shown to impair function, right? It may temporarily make you feel better, but what happens when you come down from that high? What happens when you're not drunk anymore, right? What are you going to do? That problem or that issue or that feeling may still be there, right? So the biggest tool that we have to keep us empowered is to actually utilize these tools to cope with whatever this feeling is, and then just like a red balloon, just to let it go, all right? Overcome that stigma and seek help is going to be the first step. Don't feel bad because you're feeling this. Just be aware that you're feeling it, and then go out and seek that help that you need. Go find those resources. All right, so a little bit of a review, all right? We described what it means to be psychologically healthy, right? Again, there really is no baseline for normal, all right? Everyone's going to be different, but understanding what does psychological health mean for you personally. There are some hereditary things that can be passed down, but the majority of the things, we find that at least 75% of the things that we encounter in our lives can be controlled by us, right? It can be changed by us. We discuss psychological approaches you can use to face different life challenges, to look at positive self-concept and positive self-esteem, right? One of the big ones that I use, and I know a lot of individuals that use, is that positive verbal reinforcement. So telling yourself you are intelligent, you are successful, right? You are a multimillionaire if you want to be a multimillionaire, right? You are a healthy individual, right? Giving yourself those positive feedbacks, because if you don't pump yourself up, who's going to pump yourself up, right? Who's going to pump you up, all right? We looked at the different types of psychological disorders. So we looked at anxiety, we looked at depression, we even went into suicidal thoughts, schizophrenia. The biggest thing with those is being able to recognize the warning signs and the risk factors, and to understand that there are protective factors that we can utilize, such as having a positive mindset, surrounding ourselves with positive individuals or individuals that can actually uplift us, right? Cutting off those relationships of those individuals that are being extremely negative, right? There are, again, things that we can do. We just have to be able to recognize those, and we have to understand the protective factors, especially when it comes to dealing with suicide. So again, I can't stress enough, if you are having suicidal thoughts, or someone you know is having suicidal thoughts, please go utilize those resources, seek out that help, right? We summarized models of human nature. We talked about the different types of therapies, one of them being DBT. Again, do these therapies with someone that is licensed and educated on how to properly carry these out. Please don't try to go do these yourself. all right, because you could end up harming someone mentally more so than helping them mentally, all right? So understand your limitations and understand what you should handle and what you should not be handling, what you should pass on to that expert. All right, we describe different types of help available for psychological problems. So when it comes to psychological health, what we really want to do is we want to understand the different methods that we can utilize to be able to help ourselves mentally, because again, everything starts with the mind. What your mind says, your body will follow. All right. So there are those stories where individuals have told themselves they were pregnant over and over again, and they physically started to look like they were pregnant. There was no baby, right? But mentally, they told themselves this over and over, so your body is going to start to follow. So if you tell yourself that you're fat and you will never lose weight, or your dad had a heart condition, so you're going to have a heart condition, right? Your body will follow. So be very careful with the words that you say. One story that I like to tell my students is that there's a patient that was misdiagnosed with cancer from a physician, right? The physician told him you have 3 months to live. Almost to the day, died 3 months later. Upon the autopsy, they saw that this individual actually had no cancer, right? So some would say, well, how could he die of cancer if he had no cancer, right? It's all in the mind. It's the mindset. He believed that diagnosis that the physician gave him. He believed he was going to die in 3 months. He died 3 months almost to the day just to find out that this person had no cancer. So imagine, had his mindset been different, what could have been his outcome, right? All right. There are some alternative images. So those that like to kind of see things instead of in a graph form, or like that pyramid that I had, you like to see things in kind of word form. We talked about the Maslow's hierarchy of needs. So these are some extra notes that you can write down for this. Again, if you have any questions, please feel free to ask me, right? Just send me an email, or you can save them for class. All right. I'm going to leave the slide up for a little bit for you guys, but I really hope that you found a lot of benefit from this chapter. It's about an hour and a half long, so I know you're not going to get through all of it in class, but that's fine. Again, if you have questions, let me know. We'll kind of recap some of this stuff in class, and I hope you really enjoyed this video. So thank you so much. I appreciate it. Nerve cell communication, if you want this slide as well, if you want to just see the individual steps of how that nerve cell communication actually happens, then here you go. I got it for you. All right. I will see you guys in class. Thanks. Bye.